Hello guys, this is Michael here, sports podiatrist working at Harding Podiatry in the sunny northern beaches of Sydney. Today, we're going to be discussing another running related injury and something that I am treating on a daily basis. Now, this injury is an overuse injury and something that we call Achilles tendonitis. The first thing we need to address is, what is Achilles tendon? And then, what is tendonitis? Now, the Achilles tendon is the connective tissue that runs from your heel bone into your calf muscles. The function of the Achilles tendon is to dorsiflex your foot and helps with propulsion. Weight and gender are all factors that can contribute to Achilles tendonitis. Now, what we need to look at as well is the cause of the activity levels that the patients are doing. Activities that involve springing of the forefoot, stair climbing, or running activities all can increase the patient's risk of developing Achilles tendonitis due to the overload of the Achilles tendon. Most patients, when they experience Achilles tendonitis for the first time, will experience some mild discomfort in the back of the heel after running activities. In more severe cases, patients will then experience pain the next morning. What they usually experience as well is some stiffness and discomfort upon palpation, which will either be at the heel bone or in the mid-portion part of the Achilles tendon. The most common area of injury for the Achilles tendon is within the mid-portion part because this has the least amount of blood flow. Therefore, if a patient has injured the area and they are not addressing the cause, then they're at a very high risk of further injury. When we look at the treatment options for Achilles tendonitis, we have to address the cause and then also treating the effect. When we treat the cause, we have to look at the patient's activity levels first, and then of course provide in-depth information regarding activity modification. This may mean reducing the running activity and performing non-weight bearing activities such as swimming or cycling to reduce the load of the Achilles tendon. Using our ultrasound machine, we can identify if the bursa close to the tendon is also inflamed, so we ensure our treatment options do not further inflame the area. An important factor that we need to address is the patient's foot posture. If a patient has a foot posture that is placing increased strain on the Achilles, then they are at risk of injury, meaning if the arch is too flat or too high, then pressure is not equally distributed throughout the lower limb. Now, you can see in this image that the Achilles is not in a vertical position, placing the Achilles in a mechanical disadvantage. Here, we can see how with custom orthotics and footwear, you can address the position of the Achilles during gait, reducing abnormal force throughout the structure. A supportive shoe with a forefoot rocker will also assist as it reduces stress on the posterior compartment during propulsion. Now that we've addressed the mechanics, we then need to address the strength of the posterior muscle group to build the muscle tissue capacity. We usually bring our sports physiotherapist in to discuss an exercise regime and provide a roadmap back to physical activity for the patient. This aspect of the treatment plan is vital. If we strengthen the Achilles tendon and the calf muscles, then they are at a reduced risk of tearing because they're a stronger structure. In some chronic cases, we have to use shockwave therapy, GTN patches, or PRP injections to promote healing. If you're serious about your activities and you have been experiencing any discomfort or you think that you're at increased risk of injury, I would advise you to organize a consult. Thank you guys for tuning in, and I look forward to speaking to you soon.